Communities across the country are trying to find an answer to the opioid crisis. Illinois is testing out a program that lets doctors give patients access to medical marijuana instead of an opioid prescription. And we talked to a man who says pot helped him get clean.
Good morning, everybody, and welcome to Be a Voice on Usula Radio. This is Britt Carpenter.
When Britt Carpenter takes to the air on his Philadelphia radio show, it's a chance to pay it forward, to talk to those dealing with issues like addiction, a battle that he knows too well.
I was addicted to opiates for many years. I started back in the early 2000s after a car accident.
To treat his injury, doctors gave him painkillers.
I had this bag full of pain pills that looked like a Pez dispenser threw up in it.
And like so many others, what was supposed to help him nearly destroyed him. Those painkillers leading to a heroin addiction.
Fell into a bad situation again, met the wrong person, and went down the pathway of hell for a few years after that.
Now, 4 years sober, and rehab was not his savior.
I looked at different ways that I can help myself go clean off the opiates, and one of them was, I did extensive research, was on utilizing cannabis.
He kicked narcotics with cannabis. For years, Britt had used marijuana recreationally, but this time, pot helped him detox.
I wasn't feeling as shaky as most people or as I had done before when I tried to go clean. I wasn't sweating as much. I was able to have an appetite. I was able to gain almost 40 pounds.
As helpful as cannabis was for him, it is illegal in his home state of Pennsylvania. But now some states that have not legalized marijuana are realizing cannabis can be an answer in the opioid crisis. Right now, Illinois has a pilot program where doctors can give patients access to medical marijuana as an alternative to opioids. So far, 1,500 people have taken part.
We feel that this program is an opportunity for patients and for physicians to work together to have a different approach to the types of pain that an opioid was used to help those patients.
While Britt will tell you marijuana was the answer for him, he says it may not be for everyone.
I don't encourage them to just go buy the cannabis and say, okay, this is what I'm going to do. I had to sit down. I had to really come up with a plan.
Yet to those who don't believe in the power of this plant, he says give it a chance, to give others a chance in the fight against addiction.
If you don't feel it's the right thing for somebody that is going into recovery or trying to go clean off of opiates, before you balk at it, do the research, find out what's there, find out how positive the results can be, because I believe I'm living proof of it.
And with more than 100 people dying every day from opioid overdoses, it is important for all of us to know how to respond to someone who's overdosing to try and save a life. The Red Cross has an online course. You're taking a look at it right here to teach you how to identify the signs of a suspected opioid overdose and what care to provide for that person.
The most basic thing is call EMS, call 911. It'll have EMS come. If you don't have the Narcan, they will bring it, but it'll also give you guidance from them on what to do until they arrive.
The Red Cross tells us that it's already heard from hospitals who say they are seeing an impact from this course. They've had people come in who have gotten care from someone who took that course, and you can register for it on redcross.org. The cost is $25.